Hey, my name is Michelle Paquin, and I am currently an undergraduate student ready to receive my degree in the social sciences with a concentration in psychology. Additionally, at the end of this week, I will also be receiving my certificate in substance abuse and addiction studies. My future goal for education is to pursue a master's degree in social work with a specialization in behavioral mental health. Hopefully, I can continue my career in the addiction counseling field, working with adolescents and their families. My hope for the future is to reduce the stigma of addiction and mental health and help those struggling with addiction recognize his or her own strengths and opportunities to make healthy life choices. Establishing its program in 1997, Teen Care at Mililani High School was one of the first sites in the central Oahu area. The CARE in Teen Care stands for Counseling, Awareness, Rehabilitation, and Education. The objective of this program is to provide accessible substance abuse services and prevention to adolescents utilizing an array of evidence-based behavioral health practices such as motivational interviewing, cognitive behavioral therapy, and trauma-informed care. Since opening its first Hawaii school-based substance abuse treatment program at Castle High School in 1987, Teen Care has since expanded its services and is currently based in 12 public schools on Oahu and 6 more on Kauai. In addition to school-based programs, Teen Care also has established 2 community-based sites in Kaneohe and Waipahu, offering intensive outpatient services to its clients. The target population for Teen Care are adolescents from 12 to 18 years of age currently in the public school system across Oahu and Kauai. In addition to those in the outpatient school-based program, Teen Care also works within the community to assist those who are in the judicial system or who have been identified as requiring a higher level of care. Counselors at each site works with youth, their families, and school staff to provide support and encouragement in making healthy life choices. Services provided by the site counselors include assessment, individual counseling, group counseling, and skill building activities that can foster healthy developmental growth and coping with stress. Teen Care's perspective regarding substance abuse recognizes the benefit of both abstinence and reduction in alcohol and drug use, ultimately allowing the adolescent to reflect on his or her behaviors and begin taking accountability for their choices. In this regard, Teen Care may best be described as adopting a harm reduction model, identifying the need to reduce the harmful consequences of continued substance use. Since the start of my practicum with Teen Care at Mililani High School, I had the opportunity to work alongside both a site supervisor and site counselor during this time. As a practicum student, I was primarily tasked with conducting screening, patient intake, orientation, counseling in both a group and individual setting, providing client education, and record keeping, all while constantly seeking consultation with other professionals within and outside the agency. In regard to seeking consultation, I feel that I was very fortunate to be able to reach out to Mr. Merriweather as well as Dr. Takeda in addition to the counselors at Teen Care. This truly allowed me to understand how to go about a particular client from different perspectives. I was also required to run passes to teachers, which was a great opportunity to build rapport with school staff in hopes of establishing a working relationship with the client's teachers. I learned that working in a school setting required proactively reaching out to teachers and administration, as the adolescent's success required involvement at a community level. As far as screening, intake, orientation, and record keeping, I felt that these assignments required great attention to detail, continued practice, and utilizing resources provided by Teen Care and through coursework. Additionally, because most adolescents who were called in for screening were either confused or frustrated, the screening process required attending to the emotional needs of the student while actively building rapport. Being honest and authentic with the adolescent in a non-judgmental manner was key in developing rapport and reducing hostility, if possible. Practicing motivational interviewing skills during the screening process was helpful in resolving ambivalence towards using substances. Although I regret not using this skill as often as I liked, through feedback and regular consultation, I recognize that honing in this skill during the screening process would have served beneficial in encouraging the adolescents in making different life choices. Counseling in both a group and individual setting, as well as providing client education, were both considered to require even more knowledge and skills. For example, understanding adolescent development was extremely crucial as this helped me recognize the needs and challenges that often arose during this stage. This included the need for identity formation both within peer groups and within the family context. Additionally, acquiring the ability to work with diverse cultures and ultimately being culturally sensitive is another skill deemed appropriate in providing effective counseling and ongoing interaction. In regard to providing client education, this also required extensive knowledge of substance use, how this may affect the adolescent's developing brain, and what to do in a stressful situation. During our process groups, we were tasked with following a curriculum that oftentimes discussed coping with stress and what tools can be used to deal with stressors in the adolescent's life. Again, this required a balance of understanding adolescent development as well as utilizing motivational interviewing techniques. Although I felt that my direct supervisor was not always the most approachable person when I needed assistance or clarification, I found that I was not restricted to relying on only one person throughout my practicum experience. As I mentioned earlier, I was really glad that I had the opportunity to work alongside other counselors and pick up on their counseling style while formulating my own. Additionally, I was glad to know that I can always reach out to Mr. Merriweather or even Dr. Takeda throughout this experience whenever I had a question about how to go about counseling a client. While it is unfortunate that I did not feel as comfortable as I wanted to around my supervisor, I think in a way this helped me challenge myself. For example, when I was scolded for not knowing how to conduct prevention with a student after screening, instead of beating myself up about it, I took this as an opportunity to practice on my own until I felt confident in delivering the information provided in the packet. I also took the opportunity to constantly schedule screening sessions throughout my day so that I can continue to get real-life practice. Additionally, when I was made to feel bad about not knowing what the assessment process looked like, I made sure to take the time to go to the assessment workshop Hina Malka was conducting the following month and participate in all the role play opportunities. The educational experiences that I felt were most significant during this practicum experience were skills I learned in my counseling skills class, the knowledge I gained from my childhood development class, the assessment and treatment of substance abuse class, and my counseling ethics course. Starting with my counseling skills class, I feel this class may have played the largest role throughout my practicum. Reason being, I felt that counseling skills was not only taught me how to conduct counseling and about the different techniques of counseling, but also how to communicate effectively with another person in general. This included not only with the client, but also with the client's teachers and with my supervisor. One skill in particular was learning how to paraphrase the client's words and say it back to them. This is really helpful when working with an adolescent client, as sometimes they feel less understood by other adults around them. By paraphrasing, I am able to show that I am actively listening and I'm trying to understand what they're feeling. Another technique that I learned in this class, and was reminded again after talking with Dr. Takeda, was a skill called empathic conjecture. If I remember correctly, this is a technique used to help the client recognize his or her underlying emotions and behaviors a little bit more clearly. I found this to be helpful when I would paraphrase what a client says to me by accessing my own experience. Oftentimes, when I work with the adolescent client, I found that they would tell me what is bothering them, but will not always make the direct connection for themselves. For example, I remember working with one client who would always talk poorly about her father, followed up with how she doesn't care that he's not close to her, but then will continue to start every session with how strongly she dislikes him. I believe her when she says that she doesn't like her father, but I realized that she may have some underlying feelings of sadness because she felt her father did not care about her. By using empathic conjecture and accessing my own experience, I was able to paraphrase back to the client what she said and some of the emotions that came about that she did not seem totally aware of. Unfortunately, it's difficult for me to say for certain if this was beneficial to the client, as I was not able to see her very often after this session. However, I do recall after doing this, she did open up a little bit more. In addition to my counseling skills class, the childhood development class I took was extremely beneficial in helping me understand more clearly what the adolescents were going through. I will admit, prior to taking this course, I absolutely did not want to work with this age group as I felt that they were too difficult to deal with. This may be in part because of how I acted as a teenager. However, after taking this course, I was able to truly understand this complex developmental stage in my life as well as theirs, which in turn completely changed my attitude of adolescence. I realized that the adolescent's behaviors are intertwined with an array of influences such as family life, peer relationship with caregivers, and school. Finally, both my assessment and treatment class as well as ethics were integral in being able to adequately complete my practicum. Although I wish I took both of these classes early on and not while I was doing my practicum, I still found both to be extremely helpful nonetheless. My assessment and treatment class was beneficial in understanding how treatment programs are conducted and the importance of the assessment process. In this class, I found that the assessment is not just a bunch of questions we ask clients, but it's the foundation of his or her individualized treatment plan. By asking the necessary questions, which would often take us 2 to 3 sessions, a counselor can identify what problem areas are most influencing the client's continued use of substances. Targeting the problem areas can help shape the treatment plan and guide the counselor on how to conduct each session. Additionally, this would ideally help the client also recognize what areas in his or her life is causing the most stress. Until I took this class, I'd realized I had not realized how unfamiliar I really was in the treatment process. My ethics course finally was essential in not only understanding what it takes to be a competent counselor, but also how to identify my own emotional thought processes. In the beginning of my practicum experience, I remember that I would often get upset with my supervisor for some of the comments that were being made. However, by utilizing what I learned in my counseling ethics class, specifically on the importance of practicing self-awareness, I realized how important it was to self-reflect on what was making me feel upset or discouraged. Although this seems like a simple rule, I found this one skill to really play a large role in how I can continue on in this field. I realized that a lot of my negative reactions were in part because of my own lack of confidence as well as lack of experience. I knew that I was inexperienced compared to others in this field. However, this just led me to realize that I can't expect to know everything right away. This goes back to my comment earlier about how my negative experience actually led to my own personal development as it allowed me to push my own limits. And last but not least, I want to acknowledge friends, family, and professionals in the field who have supported me throughout this process. The support and valuable feedback I have received throughout the duration of my practicum have played an essential part in my overall experience.